Diverticulitis is a condition where areas of the colon have become inflamed or infected. Diverticula are areas of the colon where the walls have become weakened. When diverticula become inflamed or infected, the condition that develops is called diverticulitis. Certain foods such as nuts and seeds may cause irritation to the colon walls and trigger diverticulitis, but oftentimes the specific cause of diverticulitis is unknown. Signs and symptoms of diverticulitis may include abdominal pain that is generally, but not always, in the lower left quadrant, fever, and a change in bowel habits. Oftentimes, diverticulitis can be diagnosed clinically. However, there are many instances where a CT scan of the abdomen and pelvis is needed. Blood work may or may not be done, depending on the circumstance. Treatment of diverticulitis depends on its severity. Mild cases of diverticulitis can be treated in an outpatient setting with oral antibiotics. Depending on your exam, you may require a dose of intravenous antibiotics before you are discharged. Pain medications are also prescribed in some cases. It has been determined that your case of diverticulitis is safe for outpatient treatment. It is important to take the antibiotics as prescribed, remain on a liquid diet, and follow up closely with your primary provider. You will need to remain on a liquid diet until you are told to advance your diet by your primary provider. You should follow up with your primary provider as soon as possible. Contact their office for an urgent appointment. Your provider may ask you to see a specialist such as a surgeon or a gastroenterologist. While it has been determined that you can be discharged, there are some instances where diverticulitis does not respond to standard treatments. Therefore, you should contact your provider immediately or return to the emergency department if you develop any of the following: pain worsens or there is no improvement in 24 hours, a fever develops, vomiting, rectal bleeding, new symptoms develop, your condition worsens.